Hello everyone, welcome to Tech Sharmit. In this session, we are going to discuss about the challenges which are associated with revenue cycle management or RCM. Okay, so far we have learned about the basic things about RCM, what is RCM, and what all steps are involved in for the RCM process, right? And also we have discussed the advantage or need, or you can say benefit of the RCM cycle. Now we will discuss few things which we can consider as a challenge while implementing the revenue cycle management, or RCM. Okay, and this is very important in terms of interview questions. Like there might be some questions related to the challenges, like what all challenges are there for the revenue cycle management or RCM. Then these points will help you. Okay, so let's see what all things we have noted down here. So the first point or the first thing that we can consider as a challenge is coding accuracy and compliance. Why? Because everything is dependent on coding. If the coding is not accurate, then how can we expect that the proper reimbursement will be proceed? Because coding is very essential thing, and same goes with the compliance. If you are not following the regulation, if you are not following the proper rules or standards, then how can we can expect that it will process the proper reimbursement? Okay, so this is very crucial point, and same here I have noted down. Ensuring accurate coding of medical procedures and diagnosis is crucial for proper reimbursement. If your coding is not correct, then you can't think of the proper reimbursement, right? Then the second point is staying compliant with constantly changing coding requirements such as ICD-10 updates can be challenging. As you know that we are going to follow some coding standards, ICD, CBT, right? So you should be aware of that, like what all changes are made, है ना? And like you should be updated for those things, right? Otherwise, that will be also considered as your challenge. Fine. Now, second thing is staff training and education. Doesn't matter in which domain you are working, doesn't matter in which sector you are working. If you are implementing any process, so proper training and education is required. Okay, because if you are working with a multiple team members and they are not trained, they don't have that much of educational knowledge regarding your whether coding process or RCM process, then how we can expect them to work on, right? So staff training and education is also considered as a training factor, sorry, challenging factor, because if it is not there, then for sure it would be a challenge. So same thing here I have noted down. Continuous training and education are essential for coding staff to stay updated on coding guidelines and regulations. Fine. Then we have noted down here higher turnover rates can contribute to a lack of experienced coders. Fine. So this is also a point for staff training and education. Then we have integration of technology. Implementing and integrating coding software and electronic health record like EHRs can be complex and costly. Why? Because if you are implementing anything without involving the technology, then for sure it will increase your time of process, right? Because technology we should use in order to minimize the time and efforts by the humans, right? But if you are implementing that thing, let's say electronic health record, then in that case one thing would be it might be complex for the team, right? And another one is that it would be very costly, because if you are using any tool, then you should pay for the tool, right? And if there is any bugs, then you are supposed to pay for that, for resolving those also and designing. So there is lots of cost factor that affect your integration of technology. Fine. Then we have compatibility issues. As I told you that we are going to use some software, you know that during the coding, medical coding billing process, the team is using the software and tools. So if there is some compatibility issues, because we are at the end we are going to transfer multiple information from one place to another. So if from one system, if you are working with a different system and there is some kind of compatibility issues, then it will surely affect your efficiency of the RCM process. So this is also at one kind of challenge for RCM. Fine. Now we will move to the next point, and the next point is denial management, and very crucial point. Okay, just keep a note of it. Proactively managing and reducing claim denials is crucial for maintaining a health revenue cycle. Why? Let's say you have started one process and due to some issue there is a denial occurred. Okay, and if you are not paying proper attention to it, and if you are not trying to fix your actual issue behind that denial, then for sure it will affect your revenue cycle. Because if there is a denial, then we are not supposed to ask for the reimbursement, because first thing is that we should remove those denials. So same thing here I have noted down: proactively managing and reducing claim denials is crucial for maintaining a health revenue cycle. The next thing is identifying and resolving the root cause of denial can be time consuming and require effective communication with peers, right? Let's say if there is any kind of denial occurred, so in that case we are supposed to identify and resolve the root causes of the denial. Otherwise, maybe next process also again it will be considered as denial. So for that we should identify what is the root cause of that denial, and also a proper effective communication with peer is required in such cases. Okay, because they will help you what was the reason behind denial, and then you will figure out at your end what was the mistake you have implemented, and though then later we will implement the same. Okay, fine. Then we have timely claim submission. Delays in claim submission can lead to a delayed reimbursement and negatively impact cash flow, which is fine, right? If there is a delay in submission, then for sure it will affect your reimbursement process and also affect your cash flow. Fine. Then we have streamlining the coding and billing process to ensure timely submission is constant challenge. Okay, so there should be a streamlined process between coder and biller, because that will ensure the timely submission. Otherwise, it will be considered as a constant challenge. Okay, so streamlining the coding and billing process to ensure timely submission is constant challenge for RCM process. There should be proper communication, right? And everything like proper submission should be there, timely submission should be there, then only we will be able to proceed for the further steps. Then we have pairs and variability. Understanding and navigating the specific rules and requirement of different pairs can be challenging. Just assume you are working with a multiple client. Now one client is expecting some other rules to be implemented, and they are implementing some other type of coding standards or whatever the thing is, means their requirement is bit different. Now next time when you work with another client, they might expect something else. Okay, so understanding their rules is very important, and uh, like rules and requirement for different pairs should be adaptable for you, otherwise it would be your challenge. Then we have pair policies and reimbursement rates may vary, complicating the RCM process. So this is also one challenge. Pair policy and reimbursement rate may vary from client to client, and if it is varying, then for sure it would be your challenge for RCM process. All right. Then comes the picture of audit risk. Regular audits, whether internal or external, are necessary to ensure coding accuracy and compliance. So proper audit is required in every factor, because if you are not doing proper auditing, whether it is internal or external, then we are not able to ensure that whether the coding is accurate or as per the compliance or not. Okay, so audit is very important, and if you are not implementing it in a timely manner, then it would be a one of your challenge. Okay, next point is same thing here, just focus on the second point. Preparing for and responding to audit can be time consuming and resource intensive. Fine, So these are the 2 points that comes under audit risk. Then we have revenue leakage. Identifying and addressing the areas of revenue leakage such as missed charges and undercoding is crucial for optimizing revenue. So we have that goal, right? We have to optimize our coding, optimize our revenue process, right? Then only we can process the proper reimbursement and payment would be processed. So for that, we should be aware and we should identify and address the areas of revenue leakage, which could be missed charges or undercoding. Fine. Then we have developing strategies to plug these leaks without compromising compliance is a constant challenge. Okay. All right. Then we have interdepartment communication. This is a very important factor that may become your challenge during RCM process, during implementing the RCM process. Why? Because effective communication between coding, billing, and other department is essential for a seamless RCM process. Just assume you are working like there is a two department, although there are multiple department that comes together to work for this process. But for now, just focus on coding and billing team. Let's say coding team is not providing the correct information to the billing team. So in such case, if billing team is not going back and they are not collaborating with each other to discuss the requirement to fix the issue, then it would be a big then it would leave a big impact on the entire process and it might change your mm, the timing of the reimbursement as well. Okay, so effective communication between coding, billing, and other department is essential for a seamless RCM process. Then we have miscommunication or lack of collaboration can lead to errors and delays in reimbursement, which is fine. We just discussed, right? If there is any kind of miscommunication between any of the department, not only between the coding and billing, it could be process. It could be there with any process, any department like. So miscommunication or lack of collaboration can lead to the errors and delays in reimbursement. Then we have changes in healthcare policies. Rapid changes in healthcare policies, regulations, and reimbursement model can impact the revenue cycle. Adapting to these challenges and ensuring compliance with the new requirement is an ongoing challenge. Okay, so as we know that we are totally dependent on the policies, regulations, right? So rapid changes in the healthcare policy, regulations, and reimbursement models can impact the revenue cycle. So for that, we should be aware of proper policies. Although we are updating, like we are supposed to update our team with all this information, but if there is no, but if there is a frequent healthcare policy changes, then for sure it would be a challenge for the RCM process. Okay, so yeah, these are the all points which I would like to discuss with you in terms of challenge associated with the revenue cycle management or RCM. I hope this is clear to all of you. Now, one more thing I would like to share with you, like from today onwards, what we will do, I will put one question here, and this is just for preparing you for the interviews, because I'm assuming that you all are somewhere preparing for interviews or for CPC examination or any other type of competitive exams. So in that case, it is always required to understand the program problem statement and to answer the basic questions, right? Because if you are not aware of basic things, then you are not supposed to solve the complex and other advanced things. So to fix this out, what we will do, we will discuss here some questions at the end of the session, and then you all can refer the session, and those questions will be totally dependent on the things that we have already covered. So that will recall your concepts. Okay, and then you can read the question and simply write your answer in comment section, and it should not be that much or bigger, because don't waste your time. It should be just a 1 or 2 liner answer. So here you can see it. For today I have noted down one question, which is difference between inpatient and outpatient service. So this thing we have already covered. So if you are remembering, then it means you have good hands on your topics, because you have covered the series and you know about this thing. then you can simply share your answer, and your shared answer will be helpful for other community who is referring comment section in order to find out the answer for this thing. Maybe some of them is not aware of, or not able to answer this question, so they will take a reference from your comment. So what I will do, what like who will answer it first, I will pin that comment to the comment section so that everyone can take a look of it. And to make it more interesting, what I will do at the end of month maybe, or then I will showcase three names, or uh, some of the names who has answered the questions properly and in a timely manner. So this will help us to prepare much better for the interviews and examination like CPC or any other examination. Because if you have good knowledge of basics, then only you will be able to implement the advanced things. Okay, so I highly recommend you to please focus on these questions and just try to answer it. Don't waste too much of your time. Just put one or two liner. That is enough for us, right? So yeah, that's all for today's session. I hope it is clear to all of you. In the next session, we will discuss few more things. So thank you for watching Tech Sharmit.